Banja jinge, oh, banja jinge, banja, yaba kebre, saba yaba.
I think we've done very well since the beginning in 1982. We've mounted effective care programs, prevention, we've mounted research, and I think we've got Ugandans and the rest of the world to be aware of the epidemic and take effect in order to reduce its impact. We still got a long way to go, particularly with the care. In the early days of the epidemic, the best we could do is to treat opportunistic infections. Now we have drugs which can improve the quality of life, antiretroviral drugs. Unfortunately, they are still expensive, and we very much depend on others to give us the money to buy these drugs. We need to devise a way where we have to be self-sustaining, and that's going to be a challenge for the rest of the part of the epidemic. There have been many other campaigns. That was this campaign and the others. Some of us, our campaign was slightly different, not necessarily addressing the issues of ABC, but empowering people to know the source of the infection and how they could protect themselves, whether through ABC or other means. The key message was that they should protect themselves because there is a lot of HIV out there. First of all, I think, demonstrated that HIV is not the end. People can get sick and can be cared for, and therefore caring for someone else who is HIV infected doesn't necessarily put you at risk yourself, as long as you take the appropriate precautions. I think that was the most important message. And as far as care is concerned, we've been lucky that over the years our care has improved now that we have drugs, which we didn't have before. And we've continued to show that if people take their treatment, take care of themselves, and also make sure they don't get infected or affect others, it can make a difference in the epidemic. At the time when we started the TASO in 1987, there was so much stigma and less support for HIV-infected people. And as healthcare workers, we thought we needed to do something, particularly being a doctor and not seeing your patients denied care, not only by health workers but also by relatives, was not right. So our objective was to involve healthcare workers, relatives and communities to provide support to HIV-infected patients without getting themselves infected. We hope the conference in Washington, D.C. will be the largest for when we look at what happened in 2006 in Toronto, where we had the largest conference with over 25,000 people attending. And DC, this being will be the 22nd year since the conference last took place in DC, in the US. So we expect it to be very big. As I hope also that by my being a president of the International AIDS Society and the co-chair, it will encourage other African participants and leaders to come to Washington DC. And I look forward to seeing them there.
Banja jinge, oh, banja jinge, banja, yaba kebre, saba yaba kebre, alonde.